Okay, we are back for part 2, and we are talking about the alkylating agents, and now we're talking about cisplatin. So cisplatin is a platinum complex, and there are 2 chloride ions, 2 ammonium ions, and these also work by cross-linking, resulting in denaturation and apoptosis, leading to apoptosis. So these are working on solid tumors such as in the testes and the ovaries. Cisplatin kinetics, pharmacokinetics, first it is given by slow IV perfusion, and it is water soluble. Side effects: myelosuppression, GI toxicity, nephrotoxicity, and emetogenicity, and there is ototoxicity and neuropathies. So if you remember from Taxane that the ears in the shape of the C's, and in the kidneys, you know that cisplatin will cause nephrotoxicity and ototoxicity. This is very common with cisplatin. So next we're going to talk about the antimetabolites. This is the second of the 9 we're going to talk about, and these are antagonists of folic acid. So we have the pyrimidine derivatives such as thymine, cysteine, and uracil, and then the purine derivatives, adenine and guanine. Okay, so remember that these pyrimidine and purine derivatives are antagonists of folic acid, and they belong to the antimetabolites section. First, the antimetabolites, folic acid antagonists. Methotrexate, very important, commonly used. Remember that methotrexate is an antimetabolite. So then we have the purine antagonists, such as fludarabine, FAMP, mercaptopurine, which is most often seen as 6-MP, and then allopurinol, often seen. So those are the purine antagonists. Then the pyrimidine antagonists are fluorouracil, which is 5-FU, and cytarabine, which is ARAC. So remember these 3 sections of the antimetabolites: folic acid antagonists, methotrexates, then the purine antagonists, and the pyrimidine antagonists. So generally, regarding folic acid antagonism, we must remember that it interferes with the use of folic acid, and as a result DNA is not produced, leading to apoptosis. You need folic acid in order to make DNA and RNA. So for purine antagonism, this interrupts the metabolic pathways of purine nucleotides, which results in the interruption of the synthesis of DNA and RNA. Pyrimidines, so these interrupt the pathways of pyrimidine bases, makes sense, which results in the interruption of the synthesis of DNA and RNA. So indications for antimetabolites: they are used in combination with other drugs to treat various types of cancer, such as solid tumors and some hematologic cancers. So remember, they're used in combination with other drugs. For example, acute and chronic lymphocytic leukemias, other different types, colon, rectal, breast, stomach, lung, pancreatic cancers, used in combination, these antimetabolites. They are oral and topical forms, and be used in low maintenance and be used for palliative cancer therapy, and are often used in combination therapy regimens. Adverse effects: hair loss, nausea and vomiting, myelosuppression. These are generally seen. And remember here that leucovorin is a rescue that can be used to reduce severe bone marrow suppression. So we can think of the leucovorin as a rescue. Next, we're going to talk about the cytotoxic antibiotics. So these are easy to remember. Anthracyclines. The cycline sounds like an antibiotic, doesn't it? So, for example, doxorubicin and doxorubicin, and bleomycines. These are the 2 big ones: anthracyclines and bleomycines. So if you remember that bleomycin works on the G2 phase of the cell cycle. First, doxorubicin, which is an anthracycline. Mechanism of action: intercalating antibiotic. Indications for induction therapy: ALL, AML, and CML. Kinetics: IV infusion. Metabolism and excretion. Mainly it goes through the liver. Next, side effects: myelotoxicity, accumulative cardiotoxicity. Thinking about here, free radicals. Alopecia, losing hair. Local necrosis. Extravascular application. So try to remember all of these side effects and MOAs for doxorubicin, which is an anthracycline. Then doxorubicin. Mechanism of action similar to the other intercalating antibiotic, but this one has a much broader indication spectrum. So, and this is indicated for Hodgkin's disease, NHL, myeloma, at least all localizations of solid tumors. IV perfusion intravesically, and there are side effects: myelotoxicity and cardiotoxicity. Again, remember this from the chemotox man. This will affect the heart. Alopecia, mucositis, necrosis in the mouth, and if applied paravenously. So remember these. And next, bleomycines, superoxide and hydroxyl radicals. Degradation of preformed DNA, and most effective in G2 and M phase. Remember that. Bleomycines in the G2 phase, as well as G0. So these are used for testicular tumors and malignant lymphomas, orofacial tumors, and the vulvae, penis, and skin. Side effects: shivering, lung fever, lung fibrosis. So remember here in the chemotox man, the B's in the shape of the lungs, lung fibrosis, bleomycines. Allergies, mucocutaneous reactions, low chemotox. Okay, last one we'll do before a break, the mitosis inhibitors. So these are the vinca alkaloids such as vincristine, vinblastine, and vinorelbine, and then the taxane such as paclitaxel, and docetaxel. So you can remember the taxanes from the end word taxel. So these are the mitosis inhibitors working in the M phase. So here you can see how they work. They stop mitosis. They don't let them. Either they freeze them or they stop them moving apart. But basically, think about polymerization and inhibition of depolymerization. Basically, stopping mitosis. So vincristine, vinblastine, vinorelbine, and the others. These are mitosis inhibitors. MOA: inhibition of tubulin polymerization, inhibition of mitotic spindle formation, effective in the G2-M phase. Side effects: myelosuppression and a decrease in phagocytosis, chemotaxis of leukocytes, and a decrease in the axonal transport in neurons. And we will also see paresthesias and neuromuscular abnormalities. Vincristine, vinblastine. Indications: so for ALL and AML, Hodgkin's lymphoma, NHL, multiple myelomas, in combination therapy with some solid tumors. Vinblastine, Hodgkin's lymphoma, again, NHL, testicular tumors, and choriocarcinomas. And lastly, we're talking about the taxane, so paclitaxel and doxorubicin. These are mitosis inhibitors, remember. The MOA, microtubular stabilization. Final effect is the same as vinca alkaloids. Kinetics, very low water solubility, used only as an IV perfusion. And paclitaxel, doxorubicin, these side effects: myelosuppression, neurotoxicity, and hypersensitivity, pre-medication with steroid and antihistaminics. Indications: metastatic tumors, breast, progressive ovarial tumors, NSCLC. So we're talking about non-small cell lung cancer, and Kaposi's sarcoma. Okay, let's take a break there.